Grant and I'm from Edmonton, Alberta, Canada. So my journey started about 7 months ago. I started to have ever-increasing pain down my left leg, lumbar radiculopathy and referral pain into other areas, and started to interact with various doctors and other healthcare practitioners. Initially started with some more conservative types of treatments, all of which were making my pain pattern worse. I tried everything from osteopathy to chiropractic care to massage therapy, physiotherapy, dry needling, or AIMIS as it's known in North America. Interacted with a total of 4 doctors of general practice, and it was through the interactions with the third one, who is a doctor I've been to for many years, but he'd been out of the country for a few months on a medical mission. And his area of expertise is primarily in musculoskeletal, physiological, sports type things. And at that point I'd had one of the MRI imagery tests done, and it was showing that I had a perineural or Tarlov cyst at L4, L5. The radiology report from the radiologist in Edmonton, Alberta stated that I had that type of cyst, and her follow-on commentary was that perineural cysts are, quotes, usually of no clinical significance. So in my journey, I think that diagnosis, or in my case lack of diagnosis, really slowed the process down and caused me to jump through a lot more hoops and additional tests and so on before we really had clarity around what the cause of my intense pain was. As far as how I heard about AIMIS, it was a bit of a journey to get there. I'd been doing some research online and found Dr. Feigenbaum and his expertise in Tarlov and meningeal cysts. So this was post knowing that I had a Tarlov cyst, or so we thought. In my case, it actually ended up being something different when he was in surgery. So all of the specialists that I'd been interacting with who thought that I had a Tarlov cyst, in most cases really didn't know how to treat it, or that it would likely just go away on its own, which as I've read more, it isn't the case. Okay, so it was through the search online that I was able to find Dr. Feigenbaum. I actually traveled to Dallas, Texas to meet with him in person. And he ordered a couple of additional tests, including a diagnostic nerve root block of my L5 exiting nerve root in my lower back. And it was through those additional tests that it was confirmed to be the cause of my intense pain, and then had a phone consult with him about a week after that. And as we reviewed the results of those additional tests, he said I was definitely a surgical candidate. And then we started looking at potential dates. And as his schedule worked out and as I interacted with his office staff, I was able to get in a couple of months sooner in Cyprus through AIMIS, rather than having the surgery done in Dallas, Texas. So once I knew that having the surgery through AIMIS and Dr. Feigenbaum in Cyprus was an option, I pretty aggressively pursued that. I was definitely of the mindset that I would rather spend those 2 months rather than waiting, recovering from surgery. So jumped at that opportunity, and the entire experience with AIMIS has been very positive. They've been great to deal with. All of the staff are very professional, really want to help you, treat you as family, and just have been very accommodating and supportive. My experience with Dr. Feigenbaum has been exemplary. He is a consummate professional, very caring, very willing to answer questions. His surgical proficiency is world-class. His entire team is world-class. His primary operating room nurse, Debbie West, has been very supportive and knowledgeable and helpful through the entire process. The Cypriot nurses in the American Medical Center, which is where the surgery was performed, were all very helpful, very knowledgeable, very caring as well. I felt like I was in good hands throughout the entire experience, and for that I'm very grateful. The American Medical Center is the highest tech, nicest hospital I've ever been in my entire life. It was very clean, it was bright and open, and just a very positive experience. I'm currently 1 week post-surgery and doing very well. Cyprus is a beautiful country. It's a very nice climate. It's currently snowing at home where I'm from, and it's a very nice environment to be recovering from fairly major back surgery and able to relax and get well enough to get on a plane to go home. So in my case, I came here thinking that I had a Tarlov cyst in my lumbar spine, lower back, at L4, L5. And it wasn't until Dr. Feigenbaum actually performed the surgery that we learned that I actually have a different type of cyst known as a Facet Joint Cyst. And he was able to also treat that as well. So one of the big pieces of advice that I would give to anyone who is suffering and watching this video would be question everything. It doesn't matter if a doctor is saying it to you. You need to be doing your own research, validating what you're learning, looking for other expertise, possibly even out of your country, like I had to, in order to get the help that you need. It's absolutely critical. You have to be advocating for yourself because you're the one in the pain and you're the one who has to live with it. So that's one key piece of advice I would give to others. One other thing I'd like to add is if there are any medical personnel and healthcare practitioners watching this, I would urge you to learn more about spinal cysts, in particular Tarlov cysts, and the suffering, the pain pattern, the potential treatment of those that can occur. It's not acceptable to tell a patient that it'll simply go away and that they should just suffer. So please learn more about these and contact Dr. Feigenbaum even, because he's a great resource to learn from. Thank you.